Do you think that you have low thyroid symptoms, or you have low thyroid and you're taking thyroid medication, but you still have all the low thyroid symptoms? This might be for you. Hello and welcome to another edition of the Ask Dr. Pickel Show. All right, let's talk about low thyroid symptoms. There's many people out there who suffer from what they would look up or call low thyroid symptoms, which I'm going to go over here. But also there are many people that take their thyroid medication and they've already been diagnosed or prescribed it, but they're like, gosh, I take it, but it doesn't really help. So we're going to talk about why this can occur. So these are the common symptoms of low thyroidism, hypothyroidism. When we say hypothyroid, that means low. Hyperthyroidism means high, but we're going to talk about the low and what can relate to it. And these are some of the common symptoms: brain fog, depression, fatigue, constipation, hair loss, more common ones like this, cold intolerance, muscle weakness, fluid retention, even swelling in the facial areas, dry skin. Actually, this list doesn't actually cover everything. So, if you have some of these though, it's like, hey, maybe I do have a thyroid problem, or hey, maybe my thyroid hormone isn't doing what the doctor really intended it to do because there's something else going on. So let's talk about that. All right, so at the top of the list, the first thing we've got to look at is, how is thyroid hormone made? Because when your doctors check your blood tests, they're only checking a couple of things. Then they're making this decision on, hey, here's your pill. So we've got to look at it a little more in detail and find out why. Why are you still having problems? Because if you just have common hypothyroidism, you take your pill, you're doing great. It's like, hey, as long as I take it, I am good. This video is not for you, unless you just want some more information. But otherwise, like many of our patients and people, in fact, a patient the other day, they came in, she's already been to 2 endocrinologists. They both told her the same thing. She said, hey, I'm still feeling lousy. I'm taking my thyroid medication. Then they're like, hey, well, you need to take an antidepressant. That's the next step for you. She's like, I'm not depressed. I don't want an antidepressant medication. And they were like, well, that's the next step. And another patient recently who they went a little further. They said, oh, you're taking your thyroid medication, but you're not feeling better. And then they did an ultrasound on her thyroid and found some thyroid cysts. Her thyroid was a little swollen. And they were like, well, we'll just keep an eye on it. We'll retest it in about 6 months, see if it's worse. But for now, just keep going. And she's like, but I have all these low thyroid symptoms and I'm feeling lousy. And they're like, well, your lab looks normal, so just keep doing what you're doing because there's nothing else that can be done, and we'll recheck it. So that's very frustrating for both of these patients because they're just feeling lousy. And they had the majority of those symptoms that we just saw. So the first thing that happens here is there's an area in the brain, and this is the top of the list here. In the brain, there's what's called this hypothalamus, and that's the area in the brain that regulates all of our hormones. Your thyroid hormone, your adrenal hormone, your female hormone, or male hormones, or any hormone in the body regulated by this area of the brain. Pretty darn important area. Now, this area, basically what it does is it sends a little messenger signal out called TRH. And that's thyroid releasing hormone. You won't see this on blood tests. They don't measure it. Rarely would they ever measure it. And then what happens then is that stimulates an area called, and you probably heard of this, it's called your pituitary gland. And this also sets up just kind of right about this area here, kind of above your nose and sinuses there. This is the area that makes makes multiple other hormones that tell things what to do. The pituitary gland is not in control. Some people will say, oh, the pituitary, it's the master gland. It tells everything what to do. No, actually, it's told what to do by that hypothalamus. Then it basically releases different hormones to tell other things what to do. Now, in this case, it's going to release a hormone called TSH. And you've heard of that one if you have a thyroid issue, because this is the main one your doctors look at. And sometimes they actually use that to prescribe your medication. If they notice your TSH number is high, they'll say, oh, give them more medication. If your TSH number is low, they'll say, oh, we've got too much in your system. Both of those are not true. TSH does tell you, hey, is the brain saying make more or make less, but it should not be used. Even the labs will say this: do not use TSH as a marker to prescribe or change thyroid medication dosage. All this is a messenger system, and that messenger system can be affected by other things, which we're going to get to. So then that message goes to your thyroid. And of course, that thyroid lives in the lower throat there, and it's not your Adam's apple. It's actually below that, and it's kind of a butterfly shape. I'm not the best at drawing that. All right, so your thyroid gland's important. It makes thyroid hormone. So what? It makes thyroid hormone. Well, when your doctor checks your blood, he's usually checking your TSH. He or she is checking your TSH and your free T4. So the thyroid mainly makes T4 and it makes a little bit of T3. In fact, it mainly makes this T4. About 90 to 97% is T4, and about 3 to 10% is T3. So it doesn't make much T3 at all. Now, the thing to understand is T3 is the active hormone. That's the one that actually goes to your cells eventually and gives you metabolism, which we're going to talk more about. But mainly it makes this T4. And just remember that this T4 is inactive. It really doesn't do much. So what happens then is this T4 has to make its way to mainly the liver, draw liver, and another place it goes to is the gut, your intestines. So most of it though goes to the liver. The liver's about 90%, the gut's about 10%. Meaning that when it gets to the liver or to the gut, this is where this T4 is turned into the important one, T3. All right. And this one also makes some T3. Now that T3, again, is the active hormone. That's the important one. And basically, right now, it's in a taxicab called a binding globulin. You don't have to remember that, but just remember that it's floating in your bloodstream. So when your doctors, if they ever measure your T3 level, usually if it just says T3, that's what's floating in your bloodstream. It's not the one that gets into your cell, which we're going to get to, called free T3. Also, there's another one here, too, that comes out because this T4 also turns into free T4. All right. And that's the main one. So mainly if your doctor looks at your thyroid hormones, usually they're just going to measure your TSH and your free T4. And that's all they're going to go by. And again, like I said, they should not be using your TSH to adjust your thyroid hormones. If your doctor only runs a TSH, you need to say to them, hey doc, I think there's more to this. We probably need to check my actual hormones. Because TSH can be totally off, but your hormones could be normal. Or your hormones could be normal, but your TSH could be totally off. So again, it can really vary for different reasons, which we'll get to here. But this free T4 is the other one that they'll commonly check to prescribe your dosage. So when you take thyroid hormone, synthetic thyroid hormone, that is what is that can be measured with this free T4 marker of how much is floating in your bloodstream. All right, so this T3 is important. Let's get back to the T3 because, you know, if you're having these low thyroid symptoms, then this could be an issue for you. So the T3 has to eventually go to your cells. I'm going to make kind of a cell there. And on your cells, there's little doorways called receptors. And think of it like boat docks. You've got to dock a boat on there so the passengers can get off and enter this island, this cell. So what happens is eventually that T3 turns into free T3. That's the one that enters your cells through those receptors. So that's the way, so that actually causes your cells to now be able to manufacture energy. So you can have metabolism. So very important that this process happens. So we got this whole cascade of all these things that go on. So what could go wrong? Well, how could we have a problem with all of this? All right, so there's a few things that can happen. Number one, if you have inflammation in your body, this can basically affect almost everything. If you are inflamed, which a lot of people don't realize they're inflamed. Sometimes they just feel lousy, but they don't realize there's a lot of inflammation. There are specific blood tests that can be tested to find out if you have active inflammation in your body. And then you got to find out, why am I inflamed? Because there's always going to be a reason. But inflammation will shut down the receptors. So now I've got, my blood test says all my thyroid hormones are normal, but the delivery guy can't deliver it. He's knocking on the door saying, here's your thyroid pizza, and the doors of the cell are locked. They aren't letting anybody in. The cell is saying, hey, there's a fire out there. There's inflammation. I'm not opening these doors at all. then the inside of the cell's like, but we need thyroid hormone and can't get it in the door. So this can cause low thyroid symptoms. The other thing that happens is, remember, we convert that T4 into T3. And where does that occur? Liver and gut. So if the liver has a problem, not going to work. You're going to lower your conversion. Now it's like, hey, the doctor said I got plenty of T4 in my system. I'm taking my thyroid med, but I'm still feeling lousy. Well, you may have an issue with your liver where you're not converting T4 to T3. Now, this could be caused by inflammation. This could also be caused by deficiencies. And there are a few of them that are more well known, especially like selenium, B6. Those are probably the most common ones that you'll see. And again, because there's an enzyme in that liver that has to turn your T4 to T3, and that enzyme is dependent upon certain nutrients, but it's also affected by inflammation. All right, and then also the gut. If you got gut issues, if you got gut inflammation, you've just decreased your T3 also. So now T3 is going down. So now I'm going to have thyroid symptoms, even though my doctor said my labs were normal, even though my TSH and my T4 are normal. All right. So how else can this occur? Well, let's actually go up to the top. Let's go to the brain. What could affect the brain that would make your TSH off, that would make your brain say, hey, we got plenty of thyroid hormone. What are you talking about? TSH looks normal. The doctor says, hey, you don't need more thyroid hormone, but doc, I feel lousy. I've got this whole list of symptoms. Well, there's a couple things that can affect the brain. Number one, we just talked about inflammation. Inflammatory cytokines will block the signaling from your brain to your thyroid hormone. So your brain's like, hey, I don't know how much thyroid hormone we've got. And that happens more with a condition called Hashimoto's, which we'll talk more about here in a second, which is an autoimmune condition. Now, the other thing that can affect it is low serotonin and low dopamine. These are neurotransmitters in the brain. That's how our brain communicates with these neurotransmitters. They also affect our mood. Usually if you're low on serotonin, you feel down, you feel like crying, you feel pretty hopeless. If you're low on dopamine, you feel down, you feel irritable, everybody leave me alone. Now there's a lot of other symptoms that go with those too. But again, if those are low, also your hypothalamus is not going to manufacture TRH properly, and then where that whole cascade of problems is going to occur, and you're going to be low in thyroid hormone. Now, what could affect those? Why would you be low in serotonin and dopamine? Well, if you have an anemia, like iron, B12, B6, folate, if you're low in those things, you have an anemia and you can't make those. Another one that can affect it, which we've already talked about, inflammation, but if you have a blood sugar issue, if you have low blood sugar, hypoglycemia, if you have high blood sugar, diabetes, if you have a roller coaster in your blood sugar, dysglycemia, these are all things that can affect serotonin and dopamine. And again, like we said, inflammation. All right, and then we get down here a little lower. Now, some people may have an issue with the pituitary. It's not very common. Sometimes if you have a pituitary tumor, you may get some imaging to find out on that, to rule that out. Now, here's the other thing too. Why would my TSH be really low also? Or why would my TSH fluctuate? Because sometimes you might check and get your blood test and your doctor says, hey, your TSH is really low. And then they'll check it again next time. Your TSH is really high, and they keep changing your dose all the time. And you're like, hey, you keep changing my dose, but I still feel lousy no matter what you do. That is classical Hashimoto's. All right. And what does Hashimoto's do? Hashimoto's is an autoimmune condition. This is my immune system attacking my thyroid gland. Now, conventional medicine says, oh, it just happens in some people. If you get an autoimmune condition, there's actually no gene for Hashimoto's, but they'll just say it happens, and your immune system just willy-nilly decides to attack your thyroid. I totally don't agree with that. I totally do think that your immune system is attacking something in the thyroid that can't be seen on a blood test or a typical test. Most doctors are not using electron microscopes to look at your thyroid, even if they biopsy it. And this is where heavy metals can be, chemicals could be, even infections, which can inflame the thyroid, and then your immune system starts to attack, and then you start to get these symptoms. The problem is the Hashimoto's can start to destroy the thyroid hormone, and then the doctor might say, yeah, you've got Hashimoto's, because when they look for Hashimoto's, they're going to do a blood test, and they're checking what are called the antibodies, the TPO antibodies, or the thyroglobulin antibodies. That AB means antibodies. So these are tests that if you have low thyroid symptoms, if you have low thyroid but the medication is not working, you better have this tested. You need to find out if you have Hashimoto's, because then you don't have a thyroid problem, you have an immune system problem. And you got to find out what your immune system is fighting and not getting rid of that's leading to all this in the first place. Otherwise, you go on a road to nowhere of, hey, I'll just keep taking my medication, go on the antidepressants, go on whatever they tell me, have a whole list of medications, and eventually end up in a surgery to remove my thyroid. So we don't have to go down that road. Let's be proactive, not reactive. So definitely, Hashimoto's needs to be looked at anytime you have these issues, because Hashimoto's can also affect all of this and all of this. So it's number one. In fact, in the United States, it's the most common cause of low thyroid. So if you live in the United States and you have a low thyroid issue that is not getting better despite the medication, you need to get this tested and then looked at, and then get all your thyroid hormones tested, all the way from TSH down to free T3 and all of them in between. So hopefully that gave you some great information to look at and to consider when you have these types of symptoms and issues. But otherwise, hopefully you enjoyed this. God bless, and I'll see you on the next video.